To many people, their dog is a part of their family, and if possible, they never want to be separated.
The saddest news I ever had in my life, the first thing I did was to take my dog for a walk.
I've had dogs all my life, and I find it hard to kind of understand not having a dog in my life now.
For me, I just think that they're really good company, dogs, you know.
Often when a person is most in need, their dog is unable to be by their side, such as going to the hospital or taking an exam. However, now with the availability of therapy pets, people are no longer alone when facing those difficult times. Many people dislike the idea of being at hospital, because being there could be very boring, or because of the fear of hospital. But if there was an adorable dog available to keep patients company through the stressful period, could it probably improve a patient's experience during the hospital visit? I'm here in Queen's Medical Center in Nottingham to speak with Theo and his therapy dog Ruby.
This is Ruby. I've had her since she was 8 weeks old, and so it's just something I've been doing now for about 7 years. There's hospital visiting and various visiting with therapy dogs. I set up my own organisation to be a bit more responsive to local requests. So I set up Poochers, which is pets offering ongoing care, help and extra support. And I'm very, very fortunate that when we started visiting here at Queen's, the only ward I visited was the ward I used to work on, which was a mother and baby perinatal psychiatric unit. But so many staff saw Ruby and said, "Oh, can she come to our ward?" That it grew from there. And with the support of Nottingham Hospital's charity, that allows me now to visit over 30 wards, and we come in 3 times a week. Nottingham University Hospitals Trust have set up something called RED. It's a youth work service for people who come into the emergency department as a result of violent crime or as a perpetrator of violent crime. And we've been asked to work with a young man there who was assaulted on the tram, who now has real problems in terms of anxiety going on the tram. But we're going to meet him here and use that as the reason to get on the tram so he can come out to try and overcome some of his anxieties and his fears.
Having therapy dogs in the hospital is extremely beneficial to patients' health.
Coming into hospital can be quite a very boring place, particularly if you need to be here for treatment and management and there's nothing else to look forward to. And I think, you know, having a dog like Ruby to sort of like try and break the day up, have some form of social interaction is definitely helpful. Social interaction is a very complex process. I mean, some of it is to do with interaction, conversation, talking, but there's also a huge component of where there's a bit of tactile stimulation, being able to touch something and sort of get that response back from something, particularly with dogs and as well. That's quite useful because they tend to respond to human touch. So it's very nice, when you interact with them, you get some sort of a response back.
Many elderly people can feel lonely, especially when they're ill. Those who are unable to raise a dog are able to get some of the benefits of having a dog through therapy dogs.
We tend to find that a lot of older patients that come to hospital with their medical problems are, they tend to be quite socially deprived, as in they don't have many family members or they live alone. And we tend to find that with dogs and pets coming in to interact with them, we tend to find that it's quite good because it promotes the ability for them to sort of interact and socialize. There's probably some evidence out there that suggests that, patients, particularly older people, if they suffer from loneliness, then their prognosis is worse. In terms of maybe life expectancy and just generally, I think there's some suggestion that, loneliness is actually one of those concerns that nobody talks about, but it affects older people very much. And actually, if you tackle that bit of loneliness, then you might actually also be able to improve their quality of life and so on for older people.
When we go to see elderly people, for example, people with dementia, they can't remember breakfast often. but they can remember the dog they had when they were 12, its name, where they went for a walk, its breed, and so it helps stirs memories for them. Talking to a dog is nice because the dogs are non-judgmental. They don't look at you and see an old person, they just look at somebody who's stroking them and who seems to love them. So it's also good for the elderly because it gets them moving again. Because they'll get them stroking the dog, reaching out, standing up, going to mix with her in the day room. So she does lots and lots of things.
Not only can therapy dogs provide for the sick and the elderly, they also can assist children and students in schools and universities. In Nottingham Trent University, there's an extremely adorable staff member. He is very popular amongst the students. Every year, when exam period comes, many students come to visit him for stress relief. Yet he only requires cheese in return. Now, let us know more about this special staff member.
Yeah, I'm Deborah Easter and I'm Head of Student Employability at Nottingham Trent University, and this is Jimmy Chipolata. So Jimmy is a registered therapy dog and I've had him for 2.5 years. He was a rescue dog. So he started to come in just through work to do engagement with students, and we noticed that he had a very nice personality. He loves people, he loves being with people. So we wanted to make sure that he was properly registered. So we registered with a charity called Pets as Therapy. They do an assessment. So he went through an assessment process and you fill an application in, and they had to make sure that he was very comfortable working with people, was very used to being touched and used to loud noises and busy environments. So he passed that. He did very well, and now he's qualified to go and do work with children, old people. He's very popular with students. He's very good for student engagement. So we've worked with employability. We've used him to help students come over and sign up for support, particularly for our Future You campaign, which we're doing at the moment for graduates. So making sure that we bring Jimmy in as a way to get people to come and start the conversation, and then we talk to them about the support they can also get. We've had a lot of comments from students, so particularly last year, and we'll be coming up to exam stress time again. As exams happen, we had lots of students coming to see him before exams, having a quick cuddle, feeling more relaxed. He likes cheese, so we have a lot of students come and give him small pieces of cheese and treats, and they get a cuddle in return.
Some may integrate therapy dog into their work. Others may select a job because of therapy dogs.
I will be honest, it was one of the reasons why I reluctant into working there. I was very jealous they had a dog. So the headmaster brings the dog in every day and the dog runs around and plays with the children. It's been amazing for the kids because a lot of them won't have had dogs before or had contact with them, and you often see children being quite scared of dogs, but they all love the way that they can fuss her and that she always licks them and wants to play. I always find that it's very much an icebreaker. Whenever you walk past the office, the dog comes out and gives you a fuss. You see the dog happily trotting around school and it always makes you smile. It's not too much of a distraction either. The kids will fuss the dog but then happily get back on with the work. It's also really lovely that she's there to welcome any visitors, because the first thing they see when they come through the door is a happy dog with a waggy tail, and it can't help but lift the spirits.
Do dogs really have these mystical abilities? Let's hear what the people have to say.
Ruby is a very friendly dog. She's extremely interactive and very friendly. She is always helpful to sort of come to the patient, lets them pet her and let them sort of try and take pictures with her and so on. And she generally doesn't doesn't bite, doesn't bark that much. So, I think patients are not very scared of her as well, which obviously helps.
Sad thing about pet therapy is you can't quantify it. It's not like you can say, I've taught you maths for a term, do this test. You can't do that with people to say, well, what were the benefits? On our Twitter feed, you'll see lots and lots of feedback there about the benefits of animal therapy from people who follow us. The B47, which is the Alzheimer's dementia ward here, when the Care Quality Commission came in to do their report, on the service from the hospital. Ruby got a specific mention from them saying how good it was and how much the patients enjoyed it, and that's a third-party reference to say how good she is.
Jimmy is extremely popular, with over 4,000 followers on Instagram, and has had interviews from many local and international media outlets.
I think it's a nice idea to bring a dog into the library.
Stress relief, just something to put your mind off doing some revision.
It's really cute. It's really nice to just pet a little bit.
It's definitely takes anxiety off.
So, how does one become a therapy dog?
Any owner that wants their dog to be a therapy dog has to go through an assessment test. I'm very, very fortunate that my local veterinary practice, which is Ashfield House, has agreed to do the assessment test on any dogs that want to join us. But if your dog is well behaved, it's really easy. People who wish to become volunteers, a lot of it can be sometimes because they have a relative that's in hospital and they can't bring their own dog in, so they think, oh, my dog can become a therapy dog. But by the time they're going through the process and their relative gets discharged, they then lose interest. The only difference between volunteers, people will say, I haven't got the time. It's not a case of having the time, it's having the heart. And unless you want to do it and you're committed to it, then it's always going to be a nightmare in any volunteering role. There's no reason why the vast majority of dogs couldn't do this if the owners were prepared to give a bit of time.
Becoming a therapy dog can be easy for some and difficult for others. But in the end, the time and effort sacrificed is all worth when they bring happiness to those in need.
Research will say stroking an animal, dog, cat, rabbit, whatever, will lower your heart rate, lower your blood pressure and produce a hormone that makes you feel happier. But realistically, they do lots more on top of that.
They look like they're just quietly being stroked. But often this moment of warmth is what people need to find the motivation to recover, whether it's illness, loneliness or stress, allowing them to see hope in their future.